The UK's healthcare system is on the brink of collapse, and it's happening right before our eyes. Over 7 million people are currently waiting for treatment, while the NHS faces its biggest staffing crisis in history. Hospitals are overwhelmed, services are stretched beyond breaking point, and yet the situation keeps getting worse. What's driving this downfall is not just the pandemic or rising costs. There's a deadly combination of underfunding, political failures, and a broken system that no one seems to be able to fix. Every day, patients are left waiting for hours, sometimes days, just to get basic care, and many don't even know when or if they will receive treatment. The heart of the NHS is slowly being ripped apart, and the most vulnerable are paying the price. But it's not just about money or numbers, it's about lives. Doctors and nurses are quitting in droves, leaving the system with a shortage of over 100,000 workers. The consequences are unimaginable. People are suffering, falling through the cracks, and losing hope. What happened to the NHS? A system once the pride of the nation. How did we reach this point where care is no longer guaranteed and the future looks so uncertain? The truth is shocking, and the answers might just surprise you. Stick around to uncover the hidden reasons behind the NHS's downfall and the crisis that's threatening to undo everything. Number 1. Rising demand for services. The UK's healthcare system is under immense strain due to a significant rise in demand for services. With the population steadily increasing, particularly among the elderly, the pressure on healthcare services is growing at an alarming rate. As of 2025, the UK's population has reached over 67 million, and this number is expected to keep rising. A major contributor to this rising demand is the ageing population. The number of people over the age of 65 has grown exponentially in recent years. In fact, it's predicted that by 2040, almost 1 in 4 people in the UK will be over 65. This demographic shift places enormous pressure on the NHS to provide long-term care, routine checkups, and support for chronic health conditions that are more prevalent among older adults. Additionally, medical advancements mean people are living longer lives, but often with more complex health conditions that require ongoing treatment. While this is a positive development, it also means that the demand for healthcare services is increasing significantly, and the system simply cannot keep up. The rise in demand isn't just due to an aging population. There's also an increase in the prevalence of chronic conditions like diabetes, heart disease, and obesity, which require frequent and continuous care. As a result, waiting times for appointments, treatments, and surgeries have soared, leaving patients frustrated and at times in dire situations. The increasing demand for services is one of the primary reasons the system is struggling to cope with the rising pressures, leading to overworked staff and a diminishing quality of care. Number 2. Chronic underfunding. One of the most critical factors behind the breakdown of the UK's healthcare system is chronic underfunding. Despite the NHS being one of the largest public healthcare systems in the world, it has been plagued by persistent budget cuts and a lack of adequate financial investment in recent years. In fact, in 2025, the NHS budget is struggling to keep pace with the growing demands of the population. Over the past decade, inflation has risen, while government spending on healthcare has not kept up with these economic changes. The financial gap between what's needed and what is available has resulted in reduced resources, affecting the quality and availability of services. Hospitals, clinics, and primary care facilities are all feeling the effects of these financial constraints. The consequences of underfunding are evident in the lack of staff, outdated equipment, and the deterioration of facilities. Many hospitals are unable to invest in new medical technologies or maintain infrastructure to meet rising patient demand. With staffing shortages, healthcare workers are pushed to their limits, leading to burnout, low morale, and higher turnover rates. This directly impacts patient care, as there are fewer trained professionals to meet the growing demand. Additionally, long-term care services have been significantly affected by the lack of funding. Many elderly patients who need nursing homes or home care services are left waiting for weeks or even months, which worsens their health outcomes. As the system becomes more financially strained, the quality of care continues to decline. Without sufficient investment, the NHS will struggle to provide the necessary care, putting lives at risk and further deepening the crisis. Inadequate funding is, therefore, a key driver of the healthcare system's collapse. Number 3. Staff shortages. One of the most alarming reasons behind the breakdown of the UK's healthcare system in 2025 is the severe staff shortages. The NHS has been struggling with an acute lack of trained professionals for years, and the situation has only worsened as demand for healthcare services continues to rise. As of 2025, there are over 100,000 vacancies in the NHS across various departments, from doctors and nurses to administrative staff and specialists. The reasons behind these shortages are multifaceted. Brexit led to a significant reduction in the number of healthcare professionals coming to the UK from the EU, exacerbating the staffing crisis. Additionally, the high stress levels, long hours, and poor working conditions have led to increased rates of burnout among existing staff. Many healthcare workers have been forced to leave the profession due to the overwhelming pressures, contributing to the rising number of unfilled positions. Staff shortages have had a devastating impact on patient care. Waiting times for appointments and treatments have skyrocketed, with some patients waiting months for even routine procedures. In extreme cases, patients may be turned away or forced to seek private care, leading to inequality in the system. For the healthcare workers still on the front lines, the lack of support and excessive workload often results in mistakes, compromised care, and even fatalities. These shortages also contribute to the growing mental health crisis within the NHS, as healthcare workers are pushed beyond their limits. In summary, without a significant investment in training, recruitment, and retention of healthcare staff, the UK's healthcare system will continue to deteriorate, leaving patients and workers alike facing an increasingly difficult situation. Staff shortages are a core issue contributing to the collapse of the system. Number 4. Ageing population. The UK's ageing population is another major factor contributing to the breakdown of its healthcare system. As the number of older individuals continues to increase, the demand for healthcare services, especially long-term care and specialised treatment, has surged. In 2025, the proportion of the population over 65 years old is expected to be around 23%, with projections showing a steady rise in the coming decades. This demographic shift is placing immense pressure on the NHS, which is already stretched thin due to staff shortages and underfunding. Older adults often experience multiple chronic health conditions, such as heart disease, arthritis, dementia, and diabetes, which require ongoing care and frequent hospital visits. As people live longer, the need for specialised medical services, including palliative care and rehabilitation, has intensified. With increased healthcare needs comes increased costs. Treating elderly patients is often more expensive, as they may require longer hospital stays, specialised equipment, and greater medical attention. Many healthcare providers are struggling to manage these rising costs while trying to maintain care standards. Additionally, the strain on social care services is significant. The elderly often require home care or nursing homes, but there is a severe shortage of these services, leading to delayed discharges from hospitals and bed blocking. This backlog not only affects the elderly, but also limits hospital capacity for other patients. Ultimately, the UK's ageing population is a double-edged sword for the healthcare system. While advancements in healthcare have led to longer life expectancies, the increasing number of elderly people requiring complex care continues to overwhelm the system, further contributing to its decline. Number 5. Privatization pressures. The growing privatization of the UK's healthcare system is another significant factor contributing to its breakdown in 2025. Over the past few decades, there has been a gradual shift toward involving private companies in the delivery of healthcare services. While privatization proponents argue that it can increase efficiency and reduce costs, the reality is more complex and often leads to disparities in care. One of the most concerning trends is the outsourcing of essential NHS services, including ambulance services, GP practices, and even hospital operations to private firms. These companies are often profit-driven, leading to the prioritization of cost-cutting measures over patient care. As a result, private companies may reduce staff levels, compromise on quality control, or limit access to certain services, all in the name of maximizing profits. This trend also leads to the creation of a two-tiered healthcare system where those who can afford private care receive faster, more personalised treatment, while those relying on the NHS face longer waiting times, lower quality care, and often less choice. The gap between the rich and poor in terms of healthcare access is widening, creating an environment of inequality within the system. Another major issue is the increased costs associated with privatization. As private companies become more involved, the NHS is often required to pay higher prices for services, equipment, and treatments. These rising costs can lead to further budget cuts for public healthcare services, exacerbating the funding crisis and leaving the system even more vulnerable. Ultimately, privatization pressures are undermining the core values of the NHS, which was originally founded on the principles of universal, free healthcare for all. Without a shift away from privatization, these challenges will only continue to grow, further contributing to the system's collapse. Number 6. Systemic bureaucracy and inefficiency. Another key factor contributing to the breakdown of the UK's healthcare system is the growing issue of systemic bureaucracy and inefficiency within the NHS. While the healthcare system in the UK is large and complex, many of its issues stem from overcomplicated administrative processes and a lack of coordination between different healthcare providers. These inefficiencies not only waste valuable time and resources, but also have a direct impact on patient care. One of the major problems is the excessive red tape that often delays treatments and services. Patients frequently experience long waiting times for appointments, diagnostic tests, and procedures due to the bureaucratic hurdles they face when navigating the system. Referrals, authorization processes, and insurance paperwork create bottlenecks that slow down the entire healthcare delivery process. This also means that patients may have to wait weeks or even months before receiving the care they need, worsening their health conditions in the meantime. Furthermore, there is a noticeable lack of integration between various parts of the healthcare system, such as hospitals, GP surgeries, and specialist clinics. This lack of coordination results in fragmented care, where patients may need to repeat medical histories, undergo redundant tests, or receive conflicting advice from different healthcare providers. The absence of a unified system often leads to duplication of services, wasting both time and money. The bureaucratic nature of the NHS also leads to staff inefficiency. Administrative tasks take up a significant portion of healthcare workers' time, leaving them with less time to focus on direct patient care. This not only impacts the quality of service, but also contributes to staff burnout. Number 7. Mental health crisis. The mental health crisis in the UK is one of the most pressing issues contributing to the breakdown of the healthcare system in 2025. For years, mental health services have been underfunded and overstretched, leading to significant gaps in care and growing demand that the system simply cannot meet. As mental health issues become more prevalent, especially post-pandemic, the demand for services has reached an all-time high, while available resources remain woefully inadequate. In 2025, 1 in 4 adults in the UK is expected to experience a mental health problem, yet only a fraction of them will receive the care they need. Long waiting lists for therapy, psychiatric assessments, and inpatient care are common, and many individuals are forced to wait months before they can access treatment. This delay in receiving help can lead to escalating conditions, with individuals becoming more vulnerable to self-harm, suicide, or chronic mental health disorders. The lack of mental health professionals is another significant barrier to care. There is an acute shortage of psychologists, psychiatrists, and mental health nurses, leaving those who do seek help with little support. Mental health workers themselves are often overworked, leading to burnout and high turnover rates, which only exacerbates the problem. Another issue is the stigma surrounding mental health, which often prevents individuals from seeking help until their conditions become critical. The lack of public awareness and insufficient community-based support also contribute to the rising crisis. Ultimately, the mental health crisis is not just a personal issue. It is a societal problem that places immense strain on the healthcare system. Without significant investment and a shift in priorities, the UK's healthcare system will continue to struggle with this growing crisis. Number 8. Rising costs of healthcare. The rising costs of healthcare in the UK have become a significant burden on the NHS, contributing heavily to the system's breakdown in 2025. As healthcare demand increases, so do the costs associated with providing care, from medical treatments to hospital infrastructure and pharmaceuticals. The financial pressures on the NHS are growing at an unsustainable rate. The inflation of healthcare costs, combined with the underfunding of the NHS, has left the system struggling to meet the needs of a rapidly increasing patient population. One of the major drivers of rising costs is the cost of medicines and medical technologies. Drug prices have surged in recent years, with some life-saving treatments becoming prohibitively expensive. As the NHS is responsible for purchasing these drugs, it often has to make tough decisions about which treatments to fund, which can lead to delayed care for patients or rationing of essential services. The increasing costs of new technologies, such as advanced imaging equipment, have also added to the financial strain on the system. Another significant cost factor is the aging population, which requires more complex and prolonged care. Older patients often need long-term care, including hospital stays, rehabilitation, and palliative care, all of which are expensive and add substantial financial pressure on the NHS. The increasing prevalence of chronic conditions, such as diabetes and heart disease, also requires ongoing treatment, further driving up costs. Additionally, staffing and operational expenses are rising. The cost of training healthcare workers, maintaining facilities, and managing day-to-day operations has escalated, leaving the NHS with fewer resources to dedicate to patient care. Without a significant change in funding, the rising costs of healthcare will continue to exacerbate the NHS's struggles, leading to a further decline in the quality of care available to the public. Number 9. Political instability and policy failures. The ongoing political instability and policy failures have played a significant role in the breakdown of the UK's healthcare system in 2025. Political decisions, especially those related to funding, healthcare reforms, and staffing policies, have had far-reaching effects on the NHS. In recent years, the government has been criticised for its inability to create and implement sustainable solutions for the healthcare system, which has only intensified the issues facing the NHS. One of the most prominent failures has been the lack of consistent funding. Political leaders often make short-term promises, but these fail to materialise in the form of long-term, adequate investment. Budget cuts and austerity measures have placed immense pressure on healthcare services, leading to staff shortages, outdated infrastructure, and compromised care. These policies have created a scenario where the NHS is forced to operate in a financially constrained environment, unable to meet the growing demand for services. Furthermore, there have been policy missteps in managing Brexit's impact on the NHS. The decision to leave the EU has led to a reduction in the number of EU nationals working in the UK healthcare system, worsening staffing shortages. Immigration policies have made it difficult for healthcare professionals from abroad to fill the gaps, while government rhetoric around the NHS has added to the uncertainty about its future. The lack of long-term vision has also resulted in fragmented healthcare policies that fail to address the root causes of the NHS's struggles. Inconsistent leadership and a lack of clear direction have only deepened the system's challenges. Ultimately, political instability and policy failures have significantly hindered the NHS's ability to provide sustainable, quality healthcare, contributing to its ongoing decline. Number 10. The impact of COVID-19 and its aftermath. The COVID-19 pandemic has left a profound and lasting impact on the UK's healthcare system, significantly contributing to its breakdown in 2025. The pandemic placed unprecedented pressure on the NHS, overwhelming hospitals, healthcare workers, and resources at an alarming rate. Even years after the initial crisis, the effects of the pandemic continue to reverberate through the system, creating a backlog of untreated patients, delayed surgeries, and a healthcare workforce still struggling to recover from the immense strain. During the pandemic, elective surgeries and routine medical treatments were postponed or cancelled as hospitals focused on managing COVID-19 cases. This has led to a backlog of patients waiting for non-COVID related treatments, creating significant delays in care. In fact, over 7 million people are currently on waiting lists for procedures, with many patients suffering in pain or deteriorating health while they wait for treatment. Additionally, the mental health toll of the pandemic has been severe. The isolation, anxiety, and uncertainty caused by the crisis have led to a surge in mental health issues, which the NHS is already struggling to address. Increased demand for mental health services, coupled with staff shortages and underfunding, has exacerbated the crisis. The mental health sector is facing an overwhelming challenge, with many people unable to access the help they need. COVID-19 also had a lasting effect on the workforce. Healthcare workers faced extreme exhaustion, leading to burnout and resignations. The long-lasting effects of the pandemic on physical and mental health have left many professionals unable to continue at their previous capacity, further worsening the staffing crisis. The breakdown of the UK's healthcare system is a tragic reality, and the consequences are unfolding every single day. From rising costs to severe staff shortages, political mismanagement, to the lasting impact of COVID-19, the NHS is fighting an uphill battle, and sadly, it's losing. The system that was once the pride of the nation now stands on the edge of collapse, and it's only going to get worse unless radical changes are made. But this isn't just about the future of healthcare, it's about the lives of millions who depend on it. The NHS crisis affects everyone, from patients to healthcare workers, and we can no longer ignore the signs. If you've been shocked by what you've learned today, leave us a comment below. What do you think is the most pressing issue facing the NHS right now? Your thoughts matter, and we're genuinely interested in hearing from you. We put a lot of effort into bringing you the truth behind the headlines, and if this video gave you valuable insights, hit the subscribe button. It's just one click. By subscribing, you'll stay informed and get access to more in-depth content like this. Let's keep the conversation going and work together to understand the challenges our healthcare system faces today.